All right. Hello and good afternoon, everyone. Welcome to today's webinar, Beyond the Table, Food Insecurity in Today's America. We are excited to be hosting an amazing group of panelists today. And before we jump into introducing them, we will just go through a few housekeeping notes today. All right, so for awareness, today's session will be recorded. We will email it out to everyone who has RSVP'd or attended today. We will also upload it to Goldmine, which is the Alumni Association's version of Netflix. We also ask all of our participants to complete an evaluation. You'll receive that in a follow-up email that includes that recording. And we really appreciate your feedback, especially knowing what future topics you would like to see us talk about. Later in the session, we'll have a chance for you to submit questions via our Zoom Q&A feature. Please utilize that. We do have some prepared questions, but we're excited to also handle questions coming directly from the audience. And we want to just say a huge thank you in advance today to everyone who is attending and also to these three amazing panelists for being willing to share their time with us during a time where they have a lot of demands on them related to this topic. So thank you all for being here today. We'll use our time today to do a brief introduction of each of these folks so that you get a little bit better understanding of their to the question and answer portion of the time today. We'll start with some of those grounding questions, and then, as I mentioned, please put any questions you think of in the Zoom Q&A feature. All right, I'm going to start by introducing our first panelist, Dr. Abby Gold. Dr. Abby Gold is a health and nutrition extension specialist with the University of Minnesota Extension Department of Family Health and Wellbeing and the Department of Food Science and Nutrition. Dr. Gold holds an appointment as an associate affiliate faculty in the UMN School of Public Health, and she serves as co-director for the UMN Leadership Education and Training Program in NCH Nutrition, and also as a core research team member for the CDC-funded Prevention Research Center. Dr. Gold is active in the Association of State Public Health Nutritionists as the chair of the Healthy Food Active Committees Council, and is the immediate past chair of the American Public Health Association's Food and Nutrition section. She's actively involved in both research, evaluation, and implementation of programs that focus on food equity and ending food and nutrition insecurity, while also promoting access to healthy foods at national, state, and local levels. We'll throw it over to Abby for a couple minutes if you would like to share a little bit more about your work before moving on to the rest of our introductions.
Thank you, Sam. I'm really pleased to be here today. Thank you for the invitation. So my work really centers around health and food equity and assuring that people across Minnesota and the nation have access to healthy and safe foods. I center my work around the community as an extension specialist. And so much of my work really is about both formative evaluation to understand what are some of the things that help communities that provide asset-based kinds of opportunities for communities to build healthy food systems. So I really try to think on a larger scale as a public health nutritionist about how we can help people gain access to healthy foods for a lifetime and across the lifespan. And so some of the programs that I've been working on in the recent past are like food as medicine approaches to help not just healthcare healthcare facilities and systems integrate healthy food and into their systems, but also looking at the charitable feeding space to help like food shelves with connecting to healthcare systems. I'm also really interested in how people talk about food with each other. And so developing models for conversations around healthy foods that can be used in various settings, sometimes forgotten settings like the, I don't know if you've heard of mental health community centers, like clubhouses, where people with persistent and chronic mental illness can have conversations about how to access healthy foods. So those are a couple examples of where I've really tried to focus my energies in the past couple of years. So thank you.
Awesome. Thank you, Abby, for expanding on that important work that you're doing. I'll jump into our next introduction, Dr. Katie Loth. Katie Loth, PhD and PhD, is an associate professor and vice chair for faculty affairs in the Department of Family Medicine and Community Health here at the University of Minnesota. A researcher and practicing clinical dietitian, Dr. Loth studies how social and environmental factors, including food insecurity, influence eating behaviors, dietary intake, and weight-related health amongst children and adolescents. Her work aims to identify practical, evidence-based strategies that parents and primary care providers can use to promote healthy relationships with food and body. Clinically, she provides nutrition counseling at InPhysicians Broadway Family Medicine Clinic, serving patients who often face food insecurity, and teaches family medicine residents about medical nutrition, therapy, and food access. Dr. Katie Loth, would you mind sharing a little bit more about the work that you're doing?
Yes, thank you so much for that introduction. And hello, everyone. I'm really excited to be here and excited to be on this panel. So as you just heard, I'm a researcher and a practicing dietitian here at the U. And my work focuses on understanding social and environmental factors. So things like food insecurity and how they shape the ways that children and families eat. Also how they think about food and how they experience health. I'm going to be bringing both the perspective of public health research and clinical care to the panel today. Much of my research looks at what happens inside the home. So how parents make food choices, how children learn about eating, and how experiences of food insecurity can ripple through daily routines that families have. When families are struggling to afford food, we know that it doesn't just change what is on the table, it changes how families feel about mealtime and even how parents talk to their kids about food. We see that food insecurity can heighten stress. It also limits opportunities for connection, and sometimes food insecurity can lead to patterns of eating that make long-term health goals harder to achieve. Clinically, I provide nutrition counseling at Broadway Family Medicine in North Minneapolis. Most of the patients I see are working hard every day to stretch their limited budgets, to keep themselves and their families healthy, and to navigate challenging systems like SNAP. From my work at Broadway, I've learned that food insecurity is never just about food. It's about the daily trade-offs that families are forced to make between food, housing, childcare, transportation, and medical bills. And it's about having the ability to feed yourself and your family in a way that feels stable, dignified, and nourishing. At the U of M, I'm fortunate to be a part of a huge community of researchers who are trying to understand these issues from multiple angles. Some of my colleagues study the effectiveness of programs like SNAP or local food shelves. Others examine how food access intersects with housing or transportation. Together, we're working to identify what works best to support families and what makes a difference in real life, not just on paper. So I'm really looking forward to today's discussion and also to learning from my fellow panelists and all of you how we can continue to move forward to a more food secure Minnesota. Thank you.
Thank you, Dr. Loth. And I'll wrap us up with intros by introducing our final panelists. Michelle Trumpy, MPHRD, is the Senior Director for Public Health here at Boynton Health at the University of Minnesota. She oversees the College Student Health Survey, health promotion, and infectious disease prevention and control. Her health promotion team focuses on top campus health issues, including food insecurity and oversight of the campus food pantry, Nutritious U. Michelle also serves on the Minnesota State team for the SHEEOS, SHEEOS, Basic Needs Data Academy. Thank you for joining us today, Michelle. Could you talk a little bit more about the work that you're involved in?
Yeah, thank you, Sam. I appreciate the invitation to this panel and to be on this panel with other MPH RDs. I'm a proud Gopher alum from here at the University of Minnesota School of Public Health. And today I'm going to be bringing the campus and student perspective to this conversation. food insecurity is an issue that's impacting our campuses, both locally and across the country. And so in my role, I oversee food insecurity planning, the data of what we're seeing on campus. We know that 1 in 4 students on our campus is living with food insecurity, and the planning of the programming that we're doing, and we're rapidly expanding to be able to meet those needs, because we know that hungry students are not well positioned to learn. I am also a registered dietitian and have years of clinical experience, and food insecurity has always been a part of the work. So I will bring that perspective as well.
Amazing. I feel so lucky to share the airtime with all three of you. And I want to say thank you specifically to all three of you as our panelists for sharing your insights, and to everyone else who will be joining us today and hearing from these folks. We're excited to feature these three key expert minds who have unique insights and understanding of the topic of food insecurity and how important it is. It's very relevant in the current moment, but is always something that we should be thinking about. We will now move into the Q&A portion of our program. This is an opportunity for us to further explore the topic of food insecurity from multiple perspectives. We love to hear about the research, policy, and of course, lived experience that you're hearing about from your patients and others that you work with. Our goal today is to better understand the challenges and opportunities that are facing food access today, and learn how data and community action can inform some meaningful solutions. For our audience today, we invite you to share your questions in the Zoom Q&A feature as we continue the conversation. And I'll get us started with our first question today. Something to ground all of us a little bit is maybe important to understand, how are these things defined? So if you could all share, how do researchers and policymakers define food insecurity, and what factors most influence that today? I will pick one of you to start, if that's okay. I'm going to actually ask Abby if you would go first.
All right. Thank you, Sam, for that question. Let's ground us in some definitions around food insecurity. So if we just want to be really simple, in the American Journal of Public Health, we see that food insecurity is limited or uncertain access to sufficient nutritious food for an active, healthy life. And I would like to throw another term out there called nutrition security. And this is something that those of us in public health nutrition have been really pondering over for the last few years. And this is where we are sort of more concerned with what people feel and believe about in terms of their access to foods that promote health. And so when you connect food insecurity with nutrition security, you get a more full picture of a situation. And it's really important to understand what people believe they can have access to in terms of healthy foods. Other countries have looked at this for a long time, like in Britain, they use the term food poverty to explain the lack of like nutrient dense foods. We're just starting here in this country to really think that through.
Do either of you want to add on?
I have nothing to add on to the definition. I mean, I think you asked a little bit about what are some of the factors driving food insecurity. And so I think, you know, we think a lot about increasing food costs, which is something we are hearing a lot about in the news right now. But also things like housing and childcare costs, and income stability. So all of the things, medical care costs, right? All of the things that a family needs to be able to pay for in the course of a month all contribute, right? All the money is coming out of the same place. And so really thinking about as any of those costs go up, or as incomes become more unstable, as folks lose jobs or aren't able to kind of have a job that meets the growing costs of inflation, then those are factors that drive food insecurity.
On the campus perspective, this is something that we've been curious about for the last decade. And so we have our college student health survey, which is a large survey that helps us understand the health status and behaviors of our students. And so starting in 2015, we asked the 2 USDA validated questions on food insecurity, which is really about worry about running out of food, and then the more severe form, actually running out of food. And so we know that 25% of our students are living with food insecurity per that definition. Food insecurity absolutely happens on a continuum, from that worry to the actually running out, missing meals, skipping meals, not meeting their full nutritional needs. And people can go in and out of food security at different times or different reasons. And from a student perspective, we know that the cost of college and financing and education is really complicated right now. Even here at the University of Minnesota, it's a great investment, but we know that an undergrad would need to work 40 hours per week, 12 months out of the year, making minimum campus wage to cover full cost of tuition for 9 months, for the school year for 9 months. So that's not sustainable. And so a lot of the things Dr. Loth talked about with the rising costs of food and everything that's happening from an economic perspective is impacting our students as well.
That's really important to understand the difference here on campus for our students and how we're thinking about that in terms of the research and in the community as well. So I'm so grateful that you all are bringing up those points as we're going here. Moving into our next question, can you talk about what trends are emerging in food security rates across Minnesota? And then maybe also mention how that compares to the US more generally this past year.
I can talk a little bit specifically about Minnesota. We know that in Minnesota, food insecurity impacts 1 in 5 households. So about 20% of Minnesotans are experiencing food insecurity. And then that's more common in households with children, households with elderly folks or folks that are disabled, also single-headed households. You know, any household that you can imagine would have a little bit more need within it. And so it's estimated that it's about 26% or, you know, 1 in 4 households with children in Minnesota are struggling to afford enough food. So that's shockingly common. And again, food shelf use is on the rise. We've seen longer lines and more use of food shelves, which is another indicator that these numbers have been rising in recent years. I do think compared to the broader US, we do a little bit better here in Minnesota, which is a positive thing. But I think something that mainly comes about because of you know, a lot of the hard work that we do here at the U and in our communities and things like that to bring awareness of it, right? So it's important that we're doing a little bit better than nationally, and something that we want to be sure that that we continue to kind of advocate for and pay attention to, so that continues to be true.
So I've said this a couple of times from the system-wide perspective. 25% of our students are living with food insecurity, 1 in 4, and that tracks to national data as well. We know that nationally, 23% of undergraduate students are living with food insecurity. So this is a phenomenon that's impacting our students locally, but nationally as well. And this is an issue that's impacting both undergraduate and graduate students. On the Twin Cities campus, we saw food insecurity for our graduate students nearly double in the 3 years from 2021 to 2024.
So Sam, as you alluded to in the beginning about this moment that we're in right now with, well, at least as of yesterday, the risk of SNAP benefits across the country not being available to citizens. And in Minnesota, so if you factor in the question that you're asking about food insecurity rates, the safety net is the Supplemental Nutrition Assistance Program, SNAP. 440,000 people in Minnesota every month access SNAP. That equates to 152,000 children, 72,000 seniors, and 52,000 adults with disabilities. So we, in Minnesota, we were able to distribute the November the November benefits because we got in under the wire before USDA put a memo out saying on Saturday night that they could not, but they had already distributed those benefits and they were not going to claw the benefits back. There's no way to do that. So we found a way in Minnesota to make that happen. So the 440,000 people in our state were protected for the month of November.
Well, Abby, I feel like that leads perfectly into our next question. Those are some staggering numbers to throw out there in terms of the number of folks that actually utilize benefits here in Minnesota. Could you talk a little bit about who are those people? What are some common misconceptions about who experiences food inequality?
Oh, well, I was doing a little bit of thinking about that when I saw the question, and we have the misconception that people who use SNAP benefits use them for all of their lives. And that is not true. That is not the case. The average amount of time that a person utilizes SNAP or a family is 12 months. And that's families with children that that statistic or that length of time is for. And for elderly individuals living alone, it's over 51 months. So that definitely is a misconception that people who utilize SNAP are utilizing it for a lifetime. But we know that they're utilizing it to help themselves lift themselves into a better situation. And then they move on from that when they're able to.
Yeah.
Thank you
Oh.
for that. Go ahead, Dr.
Well,
Loth.
yeah, I was going to say I can build on that. I think one of the biggest misconceptions from my perspective is that food insecurity only affects people who are unemployed or living in deep poverty. I think sometimes people imagine it that way. And what we know from those numbers we talked about earlier, and some of the things that Abby just talked about, the reality is that many food insecure families, they're working parents, sometimes two working parents, sometimes people working multiple jobs. So this is not people who are sitting back, not looking to help themselves. Really, it's that they're working as hard as they can and they're not able to make ends meet given the costs of housing, transportation, or childcare. Or sometimes, right, it's a family that's met up against an unexpected challenge, right? So they're in a temporary situation that's requiring them to ask for a little bit of assistance, or putting them in a position where they are facing that food insecurity. So that I think is one big misconception. And then kind of related, I think a lot of people think that food insecurity is always visible. Right? They'd be able to tell if somebody was experiencing food insecurity. And I think Michelle will probably be able to build on this. This is, I think, maybe what kept us in the dark about college students for so long. The reality is that food insecurity is often hidden, right? And it's hidden behind shame. I think it's hidden behind the careful stretching of resources or parents offering food to children and going hungry themselves. But remembering that despite this invisibility, the impacts are still very real. So even if we can't see that someone's experiencing food insecurity, the impact that that's having on them and their health, their physical health and their mental health is still very real.
Yeah, on the campus perspective, I think it's important to note that this does impact college students and our campuses across the country. I think some people are surprised to learn about that or the number of students dealing with this issue. I think there's a misconception that, oh, if you're in college, you're well off, you've made it, you're privileged, you're fine. Or, hey, it's college, people are supposed to be poor and eating nutrient poor foods like ramen, for example, or skipping meals. That's just a normal part of the experience. And that is simply not true. I think there's another piece, and Dr. Loth talked about this in terms of what does it look like in terms of jobs. Students experiencing food insecurity are often working multiple jobs to try to keep up, and they are not wasting money on things like Starbucks or frivolous things like that. They're working really hard to be able to meet all of their needs, and hunger has absolute real impacts and can impact their learning.
Yeah. Yeah, and I want to bring up another point about SNAP that we don't think about, and that's the economic impact of SNAP benefits. And so when you don't have the dollars flowing to help, people buy food, that affects more than just the people that don't have money to buy food. It affects the real retailers in Minnesota and beyond. And we have 3,600 retailers in Minnesota that accepts EBT or SNAP benefits. And a lot of those retailers are in rural parts of the state. So, and the rural grocery stores are a really important, vital part of the fabric of a rural community. And so when you don't have those food dollars flowing, it can have a broader impact on the economic health of the community.
That's such a great point. I actually just read an article this morning that mentioned the university in at a small town grocer about an hour outside of the Twin Cities who they talked about how they know the names of all their customers and they know who the folks are that maybe need some extra help, who they hadn't been seeing over the last week or so. So it was a emotional article, but it really did illustrate that it's the people you see at the store who are needing this help. It's not some hidden concern that we are not seeing. All right, let's move into some of the research if possible. If you could talk a little bit more specifically about the research and effectiveness of SNAP. Does it actually improve food access and nutrition? How do we know it works?
Do you want to start with that one, Abby?
Okay, I can, and then you take over because I think probably this is more your area. But we do have several researchers along with Dr. Loth who study SNAP and food insecurity. One of those researchers is Elton Micarezzi, and he's an economist, and that's a really important discipline to help us understand some of those economic flows that we don't always think about. And it's not just the money, but it's also the human impact as a resource that we have to think about in terms of SNAP and how it makes a positive contribution to food security and eliminating food insecurity. And then what are the ripple effects of that over time in terms of health and well-being for people that are that use the benefit as well as their emotional and intellectual and all of the wellness aspects that food helps us maintain. So that's one researcher in Minnesota. Also, Dr. Melissa Laska, a colleague of ours in the School of Public Health. She's done a lot of research on food insecurity among college freshmen, which I think, Michelle, you could probably talk about. And so I'll let you do that because maybe you do know more about Dr. Laska's research, but she's looked at interventions that are needed to support struggling students and how it really, those helping with food insecurity among college freshmen can relate to their health outcomes. Another study looked at by Kolanor Samuel looked at SNAP associated with lower healthcare spending among working age adults with dependents and concluded that each additional month of SNAP participation was associated with $99 of lower annual healthcare spending per person. And if this is true for the whole country, then you're turning around $42 billion saved in healthcare costs per year. So that's pretty significant. Also, in an article by Mabley and Oles, SNAP participation is associated with an increase in household food security, and they found that SNAP participation decreased the percentage of SNAP households that were food insecure by 6 to 17%. And that SNAP participation also decreased the number of households experiencing severely low food security. So the way we categorize the food security is by low, high, and no food security. So that's just like a very simplistic explanation. So high food security would mean that you're not food insecure. So low and high. Okay, I'll leave it at that.
Yeah, I mean, I will just jump in. I'm not going to necessarily get into a bunch of super specific studies that have happened, but I do want to just like one big thing I want to say is that we know that SNAP is effective at reducing food insecurity among the families that are on it. So when you have access to SNAP, your level of food insecurity goes down. But we also know SNAP, it's the supplemental nutrition program, right? So it's not meant to fully cover a household's food budget. So one of the things we do know is that there are families who are on SNAP that still have a degree of food insecurity. And that's becoming more true with the rising cost of food. So as sort of food becomes more expensive, but SNAP dollars don't go up, there's becoming more and more families that are getting access to SNAP, and it's helping, but it's not helping cover them completely. And so bringing that up just as another point of advocacy, right? So when we think about SNAP is important, it's helpful, and all of the things Abby said about, reducing healthcare costs, reducing admissions to the hospital, reducing visits to the emergency room. We know about within families with little kids, children are less likely to struggle with behavioral challenges in school. They do a better job of meeting kind of grade level expectations for learning with reading and math. Which are all really important things for families with young children. And yet, as we continue to see increased costs of grocery prices, needing to make sure that we're figuring out a way to kind of map on SNAP dollars to that. The other thing I want to bring up is that we know that being on SNAP doesn't automatically guarantee a healthier diet. So Abby alluded to that a little bit, that there's this piece about having enough food and then having enough access to kind of healthy food that meets your nutritional needs. And those aren't always the same thing. And again, as we see, anyone who goes to the store knows, fresh produce, lean meats, eggs, milk, all these things, as they increase in cost, it becomes more challenging for folks to kind of access not just enough food, but enough food that meets their health needs. And so that's why some of the research that we have going on here at the U is how can we help people that are on SNAP or accessing nutrition assistance? How can we pair that with nutrition education, with easier access to healthy foods, with making sure benefit levels are adequate, right? And so kind of how can we make sure all of that's happening at the same time so that we're kind of plugging all those holes and getting people what they need to improve both their food security and their diet quality.
Can I just add that Dr. Harnack from the School of Public Health also does a lot of research looking at to help promote the purchasing of healthy foods by people who use EBT. So do you provide a carrot or do you provide a stick? And that is kind of the big question mark that we have out there about what is the best model within right now in the bill HR1, the reconciliation bill that was passed. There's a movement to restrict what people can purchase. But the question really remains, is it about restriction or is it about promotion of healthy foods and providing incentives for people to purchase healthy foods? So what are the right answers there? We're still exploring them.
From the campus perspective, Dr. Gold mentioned Dr. Alaska's work in food insecurity around college students. And it was actually Dr. Alaska who asked us, what do we know about this topic on our campus? And so that was the motivator to add those questions to the College Student Health Survey in 2015. And because of that data, That spurred us to the action of opening the Nutritious You Food Pantry in 2017, but also to find out more about the experiences of our students, what it's like for them, what kinds of resources and support would be beneficial to them. And we've been working on that ever since. And I think that the topic of food insecurity, it's happening across every single college campus, but what colleges can do to support their students may look a little bit different because we know the populations are different.
Yeah, thank you for saying that, Michelle. As we're having this conversation, I keep thinking about how unique it is that we are here in Minnesota and that we have this urban center here in the Twin Cities, but that impacts our student population and who engages with our campus and these resources. So it does look different here than it may look in other places. I appreciate you for naming that too. Could you all maybe give us some insights about some new approaches or innovative partnerships that are making a difference in this conversation and improving food access?
I can start. Something I'm really excited about right now is the food as medicine approach. And there are many different facets to it. But here at the University of Minnesota at the Landscape Arboretum, we have what we call a Veggie RX program. And we have a farm at the Arboretum. I don't know if everybody on the call knows that. And the farm is an apprenticeship program. And they grow a ton of food. And so they were wondering, what should we do with all of this food? And so they connected. There's a great the farm director, Dr. Tim Wilson. He started a Veggie RX program in Scott and Carver counties where he connected with 2 clinics. And they referred patients who were food insecure to the Veggie RX program. And it is a funded program through USDA called the Gus Schumacher Nutrition Incentive Program, or GUSNIP. So that's something that I'm really excited about. And then another program that we have here in Extension is called Super Shelf. And I don't know if all of you are familiar with that program, but our extension educators are actually, they're like consultants with food shelves across Minnesota. And we have over 90 super shelves that have been trained. And the super shelves provide a dignified environment for people to actually shop in the food shelf. And so if you've ever had a tour of a super shelf, it looks just almost like a little grocery store. And you can go around and take foods according to, how there are little signs on the shelves, take 2, take 3, depending on your family size. And really healthy foods are the ones that are sort of put in front of people's eyes so they can think about those foods first before some of like the baked goods or other foods that may be less healthy. But those foods are still available to people because it is a choice model. So those are 2 examples of innovative things happening.
Yeah, two things that I want to highlight. I mean, one that I just am so proud every day to be a Minnesotan about is the free school breakfast and lunch, right? I feel like that, I mean, it just makes such a big difference to every child attending school, and it makes a difference to their family. I always think about, every family has a budget, right? And all of the money that they need to cover their costs come out of that. And so even if only the kids in the family are getting access to that free breakfast and that free lunch, it makes a difference for the entire family in terms of what their food insecurity and their family budget looks like. And so that's something that I think is, unfortunately, it's uniquely Minnesotan, but it makes me really proud to live here and is something that I hope we can continue to advocate for moving forward. And then another thing, kind of from a public health, but kind of public health connection with the medical system that I find a lot of hope in and feel like is really innovative is the screening that's now happening within medical systems. So at most well child visits, and then a lot of prenatal care visits, some well adult visits, Medicare, Medicaid, health visits that are happening. You'll notice if you take your kids to the doctor, or you bring yourself to the doctor, that you're going to be screened for food insecurity. And that provides an opportunity for there to be that touch point where a physician, number one, is acknowledging that limited access or unstable access to food impacts health, right? And any conversation that you have in the room needs to be kind of bringing that forward and having that be a part of how that conversation goes. And then it also allows an opportunity to connect that family with food resources, right? And so we know that kids are getting brought into the doctor for visits as they get ready to go to school, for sports physicals as they get older, and adults are going in to manage chronic conditions and things like that. So it's just another opportunity to screen, keep the conversation going, and then connect people with resources.
Yeah, and on campus, there's a lot of partnerships as well. First of all, just across campus to bring the programming that we have for our students that takes a lot of really dedicated partners across campus to make that happen. We also have really important community partnerships beyond the U too. One example is Keystone Community Services brings a mobile food shelf to our St. Paul campus a couple of times a month, and that's a really important partnership for the students in St. Paul. And then our partnerships with the state as well. In my bio, I'm part of the statewide Basic Needs Academy, and that's really important that we're continuing to work together of what data do we need to better understand this issue, what are the barriers, how can we work together around that. The state needs to hear what's happening on the university side. And that has been a really awesome partnership that I'm proud to be part of.
I do need to mention something about that data because data is really important. It's vital for us to understand what's happening across across Minnesota, but also across the nation. And two things. One, in extension, we have a food shelf survey that we just finished. We gathered almost 9,000 food shelf customer visitors that's a lot of people. So we have data from 9,000 people kind of talking about what are their hopes and desires for when they visit food shelves. What is the environment like for them? What kinds of foods would they like to see? Those kinds of things. And we also surveyed, we have a survey of the managers so they can talk about, what are food shelves. So that Minnesota has set up, it's very unique to the rest of I don't think any other state does that. On the flip side of that, USDA has now decided not to collect food insecurity data. So while Katie mentioned that more and more healthcare systems are using a 2-question hunger vital sign for patients, at the same time, our country has decided that they are not going to collect that food insecurity data. And that data is really important for us to understand longitudinally what's happening with food insecurity. So something to think about, something to, provide information to our decision makers about why that data is important. Because without it, we're operating in the dark.
That's such a good
Absolutely.
point.
And I was just going to say, I feel like we do a lot of things really well in Minnesota, which I think makes me really proud. And I know a lot of people are thinking we're going to lose access to that data, but we can fill that in. We can fill in that gap as a state, and that's true, right? We do a lot of things as a state, and we kind of stand out in the country. I think is doing a lot of things a little bit better than other places, which is something to be proud of. And it makes it hard to know kind of how everyone else is doing and how we're doing in comparison, and are the things that we're doing here working. And so thinking about that data is so critical because it doesn't just kind of tell us what's going on. It tells us when we make a change, when we implement a program, when a policy change comes in, is that having a positive impact? Is it worth our tax dollars? Is it having a negative impact? And without data, we can't know, are we spending our money in the right ways or the most effective ways? And so that's one of the critical pieces of being able to continue to measure that.
Yeah, thank you both for pointing out the complication around the data piece. I think that's really important and goes along with a lot of things right now about where are you collecting your information and, you know, what sources can you trust for that data, such as webinars like this. It's important for people to get information from trusted research, which actually leads really nicely into one of our audience questions. I'll throw it in the chat for you panelists, but we'll ask next, what gaps in the current research are there in food nutrition security, and what direction does future research need to take?
Go for it, Katie.
I mean, I think one thing what I just mentioned is like continued surveillance, right? So it can sometimes seem redundant to keep asking the same questions over and over again, right? Like, what is the level of food insecurity from year to year to year? And I even sometimes hear people say, well, if it's not changing much, why do we care? Not changing much is information, right? And that helps us to know that the things that we're doing are holding it steady, but they're not decreasing it, right? But at least it's not increasing, right? And so that information and that continued surveillance, I think, is it's not innovative, but it's important and critical to keep up with. And then I think we are spending a lot of money on SNAP. And I think SNAP is a huge focus right now in the current policy environment. And I think it's critical to understand what parts of that program are working and how can we amplify those. And I think we have to be honest and say, are there parts of that program that aren't working as best as we want them to be? And how can we adapt them? And so I think being able to kind of continue that program in its current form while researching opportunities to improve the thing that we're doing to make sure that we're reducing food insecurity as much as we can, and that we're amplifying that nutritional quality of the food that people are getting as much as we can in a way that still provides people with the opportunity to make their own choices about what they're eating. And then I think, you know, the final piece that I always want to put a plug in for is that we spend a lot of time making health recommendations. I do at least spend a lot of time making health recommendations to families or to adults, right? Here's how to manage your diabetes. Here's how to help your child to eat better. And most of the things that we know about how to help support people's health is most of that information that we have was developed with a person in mind who has access to whatever food they want to eat and whatever quantity they want to eat it. And so really starting to think about, can we tailor nutrition education and can we tailor recommendations to physicians and to parents that meets the needs of folks who might not have continued access to all of the foods that they want to? How can we help them continue to do the best they can, even in circumstances that are less ideal?
Yeah. So we also need research on new models for improving SNAP. So for example, community supported agriculture. How can we connect SNAP with local foods and the local food economy? How can we promote community supported agriculture or purchasing of fruits and vegetables, whether fresh, frozen, or canned, at grocery stores? So really that incentive model that I mentioned early, what kinds of research questions can we ask around different models? The other important type of research to conduct is how the other federal nutrition programs are connected to SNAP. So how do we leverage WIC? How do we leverage the school meal programs like National School Lunch Program? What does it mean to have a universal meal program? Because there are 6 states in the United States that do offer universal meals. How does that connect to SNAP? And we have so many federal nutrition programs. It's a really broad landscape, but how can we connect those programs and leverage them? So we need more research around that.
Yeah. Yep. And like, how can we identify within those programs, like, are there still gaps where people are kind of falling through the cracks, right? Or are there places where we're being redundant and then we can figure out a way to be more efficient about that? And I think you're absolutely right. Like all of these different programs kind of speaking to each other and making sure that we're making the most efficient use of the limited funds that we do have so that we can be kind of responsible users of the tax dollars.
I'm always going to advocate for more research for what's happening with our college students because they're our future. They're the economic engine of our world. And so that's really important as they become our future leaders. I'm also really curious about innovation and best practices around the space between food insecurity and sustainability. I think that's a really important topic that we are grappling with. And so how can we have programs that meet the both and with the systems and everything that Drs. Loth and Gold were talking about, I really think that we need some systems modernization in this space for today's today's tech savvy person. The systems just haven't kept at the same pace, and I think that we're losing people in lots of different ways. And so, what's the research and innovation around that?
So what I'm hearing is there's so much left to research that we should not even have to ask that question. We'll never run out of topics related to food insecurity for research purposes. All right, we have one more audience question I want to make sure that we have time to get to, which is a little more related to campus. So Michelle, heads up here. But can you talk, how can we make the U make food more available or free or reduced pricing for students? Is there a food shelf that students can access, and how does that work?
Yep. So we do have the Nutritious U food pantry that is now open weekly on campus. Our main location is in the Kauffman Memorial Union behind the Goldie statue. And we also have a site in St. Paul and West Bank. And the numbers of students we've been serving have been on the rise. 2 years ago, we were serving about 1,400 students a month. Last year, about 1,800 students a month. And we just closed out October, where we served 3,000 students that month. So we are working to expand as quickly as we can. And we have a lot of other tools in the toolbox as well. We have a free meal distribution. We've got that partnership with Keystone that I talked about. We have dining dollars. It's all on our website that I can drop in the chat if you want to learn more about that.
Yeah, thank you, Michelle. We'll make sure to link that in our closing email if you want to send that to me, actually. All right, well, I think we're getting close to the end of our time. We do have a couple minutes left, though, if there's anything any of you want to share that we did not get a chance to talk about yet during this time.
There was a question. Oh, can I just say there's a question in the chat about the super shelf results, and I don't have my fingers on the website, but we have published some of those results. And so are we sending out a email follow-up?
Yes, if you want to send me the link, I can include that in our follow-up email.
Okay, thank you.
I was just gonna say, I feel like people often ask, like, especially after we spend a bunch of time talking about how significant of a problem this is, what they can do to be involved and how they can help. And so I always talk about there being kind of three things that I encourage people to think about. So donating money, if you have the ability to food shelves. We often see food drives, and donating food is great, but donating money can be more helpful. It lets them buy exactly what they need, and it can allow them to stretch their dollars further. The second thing is volunteering your time. Food shelves and community programs often rely on volunteers to pack boxes, distribute food, connect with families. And so if you have a couple extra hours in your week or in your month, thinking about looking for an opportunity in your community, and then advocating, right? So reaching out to your legislators, letting them know how important programs like SNAP and WIC are, and also remembering those other social supports, right? Food insecurity doesn't happen in a vacuum. So thinking about when you see an opportunity to advocate for affordable housing, to advocate for affordable childcare, affordable healthcare, all of these things can go a long way to ease that financial strain and give people more room in their budget to kind of to help their dollars go further. So those are things that I would think about doing if this is something that you feel inspired to take action on after today.
Thank you both for that.
And I just wanted to follow up. There was a question in the chat, but I think it's important to, there was a question around, are there food pantries on every campus in the University of Minnesota system? And there is, and it's really important work. And every campus is doing what they can to address this issue, and really cool, innovative work happening across the state. It's really great for our students in the system. And again, talking about what Katie said about ways to support. We're getting that question a lot right now. How can I help? I really want to help. And if there's resources for donations to your local food pantry, to the Nutritious You food pantry, lots of opportunities for that. We can stretch that food dollar much further due to the buying power that we have and the relationships with food banks. And so, and all of the other great advocacy efforts that Katie mentioned as well.
Thank you both for that. And I know Dr. Gold sent over this slide and one more that talks specifically about this topic. So Dr. Gold, do you want to add anything about this?
This QR code takes, the QR code takes you to a list of all the food shelves that we're aware of in Minnesota. There might have been some since we collected that information that dropped off, or some that added. So that list is by county, and also some other Twin Cities area food shelves and food banks to donate to. So that's what's in that QR code.
Awesome. Well, I want to appreciate all of you again for not just the hour that you have spent with us today sharing your knowledge, but really for all the work you're engaged with on a day-to-day basis to help bring this to light in the world that we live in now and always. And I appreciate each of you for the time you spent preparing today and for connecting with our audience. I do want to mention we want to say thank you specifically to our members of the Alumni Association. Membership powers everything that we do. This webinar is free and open to the community, and we appreciate our members for making that possible. And we'll have an upcoming slate of webinars this spring. One that we want to specifically mention is taking place on February 4th about how women mastermind and redefine our economy. A book written by Triple alumni Misty Hegenis, Swiftynomics will be featured during that one. And stay tuned to your email. I will follow up with everyone who registered today with a recording, and we will send more opportunities as they become available. Thank you, everyone, once again, and have a great rest of your day.
Thank you.